Hello, Tamika Mosley, and today I'm going to answer some questions that I posted in the Sickle Cell Facebook page for Healing Blends Global. And a few of the questions that I received, and I want to address them now. The first one was about priapism, and priapism occurs in males, and it can occur at any age, infants, toddlers, teenagers, and adults. But it's when a male has an erection that lasts for hours, and it's very, very painful. And this comes from the blockage or blood getting trapped in that area. So I want to talk about one time when I thought that my son was dealing with that. And Aiden actually got in the shower, and like 5 minutes later, he started screaming and just saying that it hurts, and he kept pointing towards his private area. And I did observe it, and it did look as it was stiff. So this was the first time that I've ever dealt with this, and the only thing that I know to do is give him more of the even flow. So what I did, I immediately gave him 2 even flow capsules, and then I started the 1 even flow every hour after that. Also let him just sit in the shower and just let the hot water run on him as well. So in the next hour or so, he was fine. And I did talk to a young gentleman last year, and pretty much the same thing. It's just taking more of the even flow. So if we go back to what is even flow, and we have to look at what does even flow do, then we can kind of understand if we have any sickle cell complications, whether it be a pain crisis, whether it be priapism, it's all due to the sticking of blood or the blockage of blood. We know in sickle cell the blood dies off every 10 or 20 days, so we know that the body does not get proper blood flow. So if we look at even flow and look at the ingredients and look at online what it does, we'll see that it supports the body to improve pain and also anemia. And what is anemia? Anemia is a condition in which a person does not have enough healthy red blood cells to carry oxygen throughout the body's tissue. And then we also see that even flow helps support red blood cells throughout the body, meaning it's going to get the body blood pumping and flowing again. And when you look at sickle cell, when the blood gets stuck, that's when the issues start to happen, right? That's when we can have strokes, when we can have organ damage, and when that chronic pain can happen or priapism can happen. But the more of the even flow that I would give my son, I noticed that he came out of whatever crisis he was having very, very quickly, because in my eyesight, I'm seeing it as the more even flow he takes, the more it's going to get his blood pumping and flowing, and it's going to push those stuck cells on through. Now blood is flowing again, and the crisis is over. The next question was about retinopathy, and retinopathy has to do with eyesight. And it's when, again, person with sickle cell disease not getting enough blood flow, oxygen through the body. And I always talk about how sickle cell can affect so many parts of the body. So we really have to be careful with that. But it's damage to the retina, and the retina can become separated or damaged. And people can start seeing different specks. You'll start seeing different. There was a young lady that I knew a couple years ago who was dealing with this. And I know that she started taking more of the even flow, again, because it has to do with a lack of blood flow. It has to do with a lack of oxygen. I know she was also doing liquid chlorophyll, and she also added bilberry to her regimen as well. And bilberry is also a great, great plant, and it's actually known for the health of the eye support. And it actually helps with circulation in the small capillaries of the eyes. So this is what I know that she began to do, and within the next 2 to 3 weeks, she started seeing clearly again, and she wasn't having any of those complications. All right, the other question was, did I ever experience in my son any breathing issues, RSV, or any type of respiratory issues? And yes, I did. Aiden was called my wheezing child, and actually teachers Doctors thought he had asthma, but he was never diagnosed with asthma. But he is my only child that would actually do a lot of wheezing. So long time ago, when I didn't know what to do, of course I would have my little breathing treatment, and he would take the breathing treatments and these steroids because it would get so out of control. I didn't really know what to do. But some of the things that I started implementing whenever he would wheeze would be things like ginger. I would give him a lot of ginger tea and also mullein, Mullein. And mullein is a plant that is actually it helps the wheezing, it helps coughs, breathing issues, and also known to create a cooling and a soothing effect on the mucous membrane. And it also helps alleviate spasms and inflammation inside of the bronchial passage. So those are some things that I would do with him. And I'm very, very proactive with my son. All my kids. If I notice the first inkling of anything, I start giving them the herbs to actually get it under control. Because a lot of times, if you don't, things can get out of control very, very quickly. So when I first hear any type of wheezing, because wheezing can be very silent, but then there's times when it can be extremely, extremely loud. Because one time he was wheezing so bad, he sounded like a freight train. So those are things that I did for him: ginger capsules, ginger tea, mullein capsules, or the liquid mullein. Also giving him vitamin C as well. At that age, I would give him maybe 3,000 milligrams of vitamin C every hour. But I just noticed every time I incorporate these things and do it on a regular basis, then he would get over that wheezing pretty quick. So that's what I did for my son, and I hope this has been helpful. So let us know if you have any more questions, and thank you all so much.